So a patient who comes to me for a full mouth rehabilitation, it's a pretty common thing for them to say, it's been a lot of years that my teeth, the health in my mouth has been going downhill and downhill and downhill. And somewhere along the way, it started affecting more of my life than just my mouth. Fast forward to we're done with their process and they tell me I want to just be able to eat raw vegetables with my grandma that she grew in her garden together. I want to have a bubble gum blowing competition with my grandkids. I mean, these are real things that people have said, this is what I want. So yeah, I feel super excited when somebody comes in and says, this is where I'm at, and I can see that ray of hope come into their eyes. It's like, yes, we're going to get to take this journey together, and it's going to be fantastic. The first time we see a patient is always for a consultation, and some patients feel terrified just to step through the door of a dental office. One thing I do ahead of time is call them the night before, and I just make sure and reassure them to know that tomorrow during your consultation, we're not going to do anything scary. We're going to look, we're going to talk, and we're going to make some decisions together, but there's nothing scary that we're doing. When a patient is going through the process, going through surgeries, going through healing, then we just really try to make sure that we are in close communication with them. We always make sure that we have their next appointment scheduled so that they always know when they're going to see us. And when they know that they've got us as a partner, it's just really reassuring to know that, they're not alone. So at Grand Dental, we use the very cutting edge of technology for doing implant surgeries. We start out by taking a 3-dimensional x-ray so that we can see their bone, in all different dimensions. We can also use that to develop a computer-generated guide that helps us during surgery to place the implants exactly where we planned. It used to take 5 or 6 appointments to go from temporaries to permanent bridges. The digital workflow that we use now cuts most of those appointments out. It only takes maybe 1 or 2 appointments to go from temporaries to final zirconia bridges mated and they're in place. So it takes a lot of the excess appointments out that used to be there before we had the technology. I wish I could video it and really capture it, because when a patient comes in for the first time, they've developed this shell from being in that deep, dark place where things were not well with their teeth and not well with their relationships in their life and stuff. And so as we go through that process with them and we get to see them start to radiate and they become themselves again. I've got a patient who every time he comes in for his cleaning, every 4 months, he brings 2 apples. One for him and one for me, because he couldn't eat an apple before. And so to be able to sit down and me bite my apple and him bite his apple, and he's got implant supported teeth, I've got natural teeth, and we're both the same. It's awesome. I love it. It's crazy how patients' lives change, because all we did was focus on their teeth, and so where they never wanted to smile before, now they only want to smile because they're so proud of how their teeth look. And where they never went out to dinner with their friends or their family before, now they want to go out all the time because they have that confidence, they have that self-esteem. My message to patients who are hesitant is there truly is hope. And if you don't believe me, I'll let you talk to our patients, as many of them as you want to, who have been through this process, and they can tell you, yes, you don't believe it now, but there is hope and there is a whole new you waiting out there. Just give us a chance and see if you feel comfortable. We will partner with you. We will take you by the hand and find that new life that you're trying to get back.